Good morning. Thank you for joining us today. I'm Constable Matthew Dawson, one of the media relations officers here at the London Police Service. To begin this morning, we would like to acknowledge the people whose lands we are gathering on today. The Anishinaabeg, the Haudenosaunee, Lenape-Wuk, and the Attawandaron people. We would also like to recognize the First Nation communities in the area, which include Chippewa of the Thames First Nation, Oneida Nation of the Thames, and Munsee Delaware Nation. I would now like to invite my colleague, Sergeant Sandasha Bao, a media relations officer for the London Police Service, to the podium, as she will be emceeing the press conference this morning. Thank you.
Hello, and thank you for joining us today. Today we will be speaking about the London Police Service's open air substance use strategy. We ask that you please hold all questions until the end of the conference, at which point I will go over a few housekeeping items. I would now like to welcome Chief Tai Trung, who will commence the press conference with opening remarks. Chief.
Thank you, Sandasha. Thank you to the media for being here, our community partners who are all here. I see a number of local businesses that are here and that have joined us. And I just want to acknowledge our Police Service Board. Some members are here. Chair Shabar, who is here, Vice Chair Ryan Goss, Member Lehman, and Member Stevenson. And of course, Mayor Morgan also sits on our board. So thank you for being here. And Executive Director Stephanie Johansson, who's also here. For the past several years, there has been a deterioration of safety occurring in our downtown core, our midtown, and our Old East Village. Our local businesses, residents, and citizens are negatively impacted by the proliferation of open-air substance use occurring in public spaces. We have had far too many incidents of violence, robberies, sexual assaults, property crimes, both reported and unreported, occurring in these areas. Property damage and open use of dangerous substances are severely impacting the greater community, including families and children that are visiting downtown Old East Village and Midtown. We've listened to our community. Our businesses and our residents need help. Now, this includes those who are struggling with mental health, substance use, and who are experiencing homelessness. I want to be very clear here. Not all individuals who are experiencing homelessness, who have mental health challenges, or who are dependent on substances are committing crimes. But just like the greater population as a whole, there are a small group that are making our community unsafe. And we are going to address this complex issue and the safety concerns that have been impacting our community. It has not been getting better, it has been getting worse. So we need to pivot. We are not walking by and leaving it for other agencies and community groups to deal with. Instead, we will be engaging, we will be intervening, and we will be conducting outreach together with our community and community partners. In most cases, people need help, and we want to ensure that those who need help receive the right support and referrals, and those who have a complete disregard for the safety of others are held to account. This is about balanced enforcement when appropriate. Starting tomorrow, our community will see more police engagement, including officer teams paired with mental health and addiction experts from CMHA Thames Valley. In the coming months, the community can expect these efforts will be strengthened by the addition of nurse police teams from London Health Sciences Centre. The success of this strategy depends on partnerships, it depends on our community, and it depends on engagement. This is not about criminalizing addiction. It's about offering people a way forward and ensuring our shared public spaces remain safe and welcoming for all. All of our officers who are engaged in this strategy will be equipped with body-worn cameras. For the past several years, our community have not been feeling safe, and this is for a good reason. It's not working. This is not a police problem. It is greater than that. But it has become a police problem because of safety. We're changing course, and we need our community to work together. I just want to thank a couple people. There's a lot of people involved in this strategy, but I want to acknowledge to my left Detective Lindsay Ryan, who runs a team that we utilize quite heavily, and she's attached to the evidence-based policing unit. Her research, her leadership, she's developed a strategy that is evidence-based and that we feel is the right strategy for our community here. And also acknowledge Staff Sergeant Sherry Baltzer, who oversees our Foot Patrol unit. She's really operationalizing all of our efforts and working with all of our community partners. And I see a number of community partners in the audience today. So I want to thank these officers under the leadership of Deputy Chief Scott Guilford, who's to my right here, and let the community know that we're listening, we've listened, and it's time to really do something different. It's a compassionate approach, but we need to engage as police. Thank you for everybody attending today, and I'm going to turn it over to Sandasha.
Thank you, Chief. Next, we will hear from Mayor Josh Morgan.
Well, thank you very much, and I appreciate the Chief's comments that he's made already. I want to focus on partnership a little bit, because as the Chief mentioned, it's a complex issue that cannot be solved without a number of groups coming together in coordination. The London Police Service and the board has really provided a direction and support for the Chief and his command team to have the resources they need to really change the organization, but position them really well for leadership in partnering with the community organizations and the wider community that is necessary to solve complex issues like mental health and addictions in our downtown core. Now, this is only one part of a larger strategy that will be deployed. As you know, Council engaging with other partners is engaged fully within our health and homelessness response and the wider supports that exist within the community system. But integrating those teams together, as the Chief identified, having partners up front who can integrate with police response and police presence like the Canadian Mental Health Association of Thames Valley, like London Cares, who are standing up here as well, like the various partners who are also supporting, who may not be represented here today, the business community, who is I see many members of who own and are here in our downtown core each and every day, whether it be downtown, midtown, or Old East Village, who have said clearly and consistently that they need support and they need help. Members of council, members of the police board, people who have constituents who have been saying to them, we need to do something more than what is already being done. This is a different approach. This is partnership. This is coming together not to criminalize the problem, but deal with crime where it exists and ensure that those who need supports with the interactions and the resources that London Police Services have with their partner agencies will have access and pathways to the supports that they need. So this is about solving a public safety issue and starting along a path where there will be more engagement, more interaction, you will see more police presence, but also a renewed commitment to the wider lens that Council has put in on this problem to challenge others like ourselves and the province to come forward with the proper resources in a community to help those in need. In just a month or so, we will see the Heart Hub in this area open, a new $500 million provincial program targeted at not just assisting those who in need, but with the specific issues of mental health and addictions. And this is not just a program that may have been inspired here by London, but a program that will exist across the province. That is how we solve these complex challenges, is by partnership, whether it's the partnership the Chief described today and the actions we're taking in the city, or the wider partnership across this province between multiple levels of government and multiple agencies to put a much more robust system in place across the entire province of Ontario. We will continue to need resources and partners and partnership in the future, but this is an amazing step today, starting tomorrow, I should say, where we are taking a new approach. And I just want to thank the partners and thank the Chief. It was not easy to pull this together. I know at the State of the City, I talked about the strategy coming very soon, but this is a strategy that you have to have the right partners in place with the right plan and the right way. So it may have taken a little more time, but we're at that point today where it's a great plan. It's got the right partners. It has the capacity to grow and expand in the right way with more partners coming in play. And for those who have been waiting for this sort of response, tomorrow is the day that it starts. So we appreciate your patience, and I look forward to continuing to support the Chief, the police, and the partners in the work ahead. Thank you.
Thank you, Mayor Morgan. I will now call Pam Tobin, the CEO of CHMA, Thames Valley Addiction and Mental Health Services.
Good morning, everyone. We are so proud to partner with the London Police Service on this important new initiative. This collaboration builds on existing partnerships like the Community Outreach and Support Team Program, the Crisis Response Team, our Emergency Department Diversion Strategy, and the newly launched Crisis Call Diversion Program. CMHA Thames Valley is the leader of community-based mental health and addiction care in this region. Last year, we supported over 4,300 individuals living with addiction who wanted to make a positive change in their lives. Our Rapid Access to Addiction Medicine Clinic alone provided more than 1,200 people care. The current demand, however, outweighs our capacity to provide essential care to people struggling in our community. Through partnerships with community partners like the London Police Service, we can continue to expand our reach. Our staff will be working with the London Police Service Foot Patrol officers using their skills and experience to support individuals living with substance use concerns. We will direct people to our community programs that are tailored to their needs. London Police Service's open-air substance use strategy aligns with one of our strategic priorities that focuses on access to care. By meeting people where they are, we remove barriers, ease system navigation, and ensure that support is delivered with compassion and respect. Thank you.
Thank you, Pam. Our last speaker is Chris Moss, the Executive Director of London Cares.
Thank you. At London Cares, we believe in the 4 pillars of the Canadian Drug Strategy: prevention, harm reduction, enforcement, and treatment. All 4 pillars must work together to create healthier communities. Our outreach team and the partners at 602 Queens Ave are prepared to support this project through compassion and harm reduction, offering basic needs and primary health care at the Commons. London Cares, St. Joe's Cafe, RHAC, and Thames Valley Family Health Team are ready to support. We work in partnership with dozens of agencies to reduce harm while advocating for hubs, highly supportive housing like House of Hope, and treatment centers that are so desperately needed in our community. This project and partnership will allow us to continue to support unhoused Londoners as we move them from street to home. Thank you.
We'll now take questions from reporters. Please raise your hand, and when called upon, I'll ask for your name and media outlet, and let me know who you would like to direct your question to. I do need to repeat each of your questions just for those watching through the live stream so they're able to hear what you asked. Dale?
Nasha, thank you. Dale Crowderson, One Free Press. My question's for the Chief. When he first mentioned the new strategy a couple months ago at the Police Service Board meeting, he mentioned that arrests and charges are part of the possible strategy. Is that still part of it? Could people be using drugs openly be charged?
So just to repeat the question, the chief mentioned at a board meeting, just in relation to arrests and charges, and you're asking whether or not that's still part of the
Is that still an option? Yeah,
strategy?
is that part of the strategy?
Okay, chief?
Thanks for the question. That's a very good question. What I'll say is, part of this strategy, as I already mentioned, it's about outreach, it's about support, it's about policing with kindness, compassion, and understanding the population that we serve. So the first course of action for our officers is actually we're supporting them not to arrest as their first course of action. Their first course of action, this is why it's so incredible that we have our partners here behind me and our partners who are joining us. The first course of action is, what does that person need? Because we do understand that substance use is a health issue, a social issue, and we know that there's complex challenges in the city and with the people that we're interacting with. So the first course of action is that individual. How can we steer that individual into some referrals, steer them to the community? Because remember, this is not a police problem. It has become a police problem. But I will tell you that we will support our officers if individuals are not complying and jeopardizing the safety of this community. So enforcement is an option, especially if individuals are not obeying the law and they're not obeying the care, receiving the care that our officers are trying to deal with from a compassionate level. And I'll give you a prime example of this, Dale. If somebody is using drugs in open spaces impacting this community, our officers are expected to engage. We're going to support them to engage. But the traditional way of policing would be enforcement. That's not where we're going to go right away. We're going to go to that individual and ask them to stop using and try to direct them to the resources that they need. But if those individuals are disregarding the officer's orders and the situation that we're trying to help them and to address for the greater community, if our officers have no choice at that point, they will arrest. Now, there's a difference between arresting and charging and exercising your discretion as officers where they can arrest and they don't need to charge. But we're supporting our officers through a lens of compassionate care with our community.
I just had a follow-up too to that, so now, all right?
Okay.
So my follow-up question would be, with this new strategy, do you anticipate more SIU investigations potentially? A large percentage of these investigations now, from my understanding, are made up of people who have ingested drugs or taken into police custody and overdose. If you're going to be dealing with more people using drugs, it seems likely that there'll be more SIU investigations, which in turn puts stress on your officers, tie up resources. Is that something you anticipate? Have you spoke with the SIU about this?
So just to reiterate Dale's question, he's wondering if this new strategy will cause potentially additional SIU investigations.
So that's another great question, and that's a question that concerns all frontline police officers, not just in Ontario, but know that when our officers are interacting with members of the public, and that interaction results in members of the public requiring medical treatment or serious bodily harm, automatically the SIU are triggered. We got to notify the SIU, and they come in and to investigate the conduct of our officers, to determine if there's any criminal activity that has occurred as a result of the impact of that individual in the community. Can you just imagine the amount of stress our frontline officers are dealing with every single day when they're dealing with situations of individuals who they're concerned about withdrawal? And let's talk about fentanyl. Extremely dangerous. So add on that stress with our officers. So I can tell you that our entire executive command team here is behind our officers. That is why during this strategy, they received additional training with our community to make sure that they understand the risks involved with interacting and engaging. And one of the complaints in this community and some other communities is that there's open drug use occurring and our officers are just walking by. That's been loud and clear, a message to this executive. And I can tell you, that is one of those reasons why our officers are concerned. Because they want to engage, they want to help, but they could be doing everything right. And the minute there's an overdose or somebody goes into serious withdrawal, those officers are under huge scrutiny, and it is stressful. So we are supporting our officers to engage. There's an expectation they will engage. That's why we're utilizing our community partners. That's why they've received additional training. That is also why they'll be equipped with body-worn cameras to protect themselves and to show them and support them that this is the community ask. The community is asking for us to engage. So there is risk for our officers, but we're going to do everything we can to support them and make sure that they have the proper training and guidance to do their job, and that is to help this community and to address the concerns.
Thanks, Chief.
All right, sorry, we'll go to CTV.
Yeah, Brian Bicknell, CTV. I have a number of sort of housekeeping detail questions. I'm wondering if I should ask them all at once or go one at a time.
Let's do one at a time, just so I can repeat them.
Okay. Is this a permanent program?
Okay, I'm going to repeat each of them, but I'll let you ask them all. So the first question was, is this a permanent program?
Yeah.
And do you want to, are we good
That's
to
just a
answer it?
yes or
Okay,
no.
then go ahead.
I can tell you we're looking at this quite extensively for the next 6 months. We're going to evaluate on a monthly basis and see where we are at. Following the 6 months, we will continue moving forward, but we're also making sure that we have the ability to upscale when needed. So this, most likely, we are aiming towards a permanent position on this. Having said that, it is really important that we deploy resources where resources are needed. So after a year or after 6 months, sir, if the downtown core, there's big changes in the downtown core, Midtown, and Old East Village, and we see a lot of success happening, and it's people are happy, and it's a vibrant area where we want it to be, we may move resources to address other areas in this city. Having said that, you have my commitment that this is a priority for us.
Okay, definitely not a yes or no question. So how big will be the complement of people involved in this program, and how many officers versus how many healthcare professionals?
All right, so the question is, how big is the complement? And if we can provide information in relation to how many police officers and how many community partners.
Yeah, so I can tell you right now, due to staffing and resources, our typical deployment in the Foot Patrol, you'll see teams of 2. You'll see sometimes 1 team. You'll see sometimes 2 teams. That's certainly not enough. With this strategy, you're going to see 3 or 4 teams of officers, so essentially doubling, sometimes tripling in terms of police presence. And then you'll see some teams that are paired up with members of CMHA. And then in the next coming months, you're going to see teams paired up with nurses. And David Mouche isn't here from LHSC, but he has been a incredible support and partner with us in supporting this initiative.
So is there a cost to this program, and what is the cost, and does it come out of the police budget, or does it come out of a different budget since there's different parties involved?
Is there a cost to this program, and what is the cost? And is it coming from the police budget or from, what was
A
the?
different budget.
A different budget.
Thank you.
So that's always an issue for our partners. Our partners are under huge pressures with resources and funding, and for us, all we can do is try to advocate and support all the incredible work that the organizations are doing in our community. With respect to our funding, we are absorbing this through our operating costs. We're moving resources and making sure that this is a success. I will also be seeking funding from the province by way of police grants available to us to compete for. So we are trying to make sure that we put all the resources in place for this. Having said that, provincial grants are not guaranteed for police. You have to apply, you have to compete for them.
Do you have a final number on the cost?
I don't. I'm, looking at it from about 2 months ago. I looked at the staffing costs to do this. You're looking at between $4 and $6 million.
That's for 6 months or for?
That's to run this program for a year.
Okay. Just one.
4 to 6 million.
Question or?
Yeah, go ahead, Brad.
So, if you want to repeat it, we know that police officers are getting extra training and this type of thing. As far as the nurses and the healthcare experts who will be working with them, will they get the training, or have they been trained in this sort of thing and working in the field in, potentially volatile situations?
And so can you share what type of training all of the community partners will be receiving in relation to being in these types of situations?
Yeah, I can speak to some of that training. And the training, if you think about it, sir, we're not asking our community partners to do anything outside of their expertise. They're already doing outreach. They're already navigating people into pathways of care. They already know the resources and the expertise that we have in this community. And they're also aware of the resources that we lack. So all we're doing is engaging and allowing our partners to deal with those individuals that police may not be the fully trained and not be the best person to deal with. Our job is safety. We'll make sure that the partners who are partnered with us have a safe environment and feel safe, but we're really not doing anything different. We're allowing them to conduct better outreach and more outreach, and outreach the individuals where traditionally, if we weren't partnered up with them, it would be a police response only. And the training that our officers received is actually from the community and the experts.
Okay, thank you. Brian, by the way.
If I could just add to that as well, the team that we'll have working with the police, they're experts. This is what we do. This is what we do every day on our day-to-day to provide the best care and services to all clients, wherever they are in their journey to wellness. And later today, actually, our team will be here and partnering with the London Police Service to provide some additional training on what's specifically required of them on foot patrol. Yeah, thanks.
Craig?
I got one question for the mayor and one question for the chief. For the mayor, isn't there a bottleneck issue here where someone has a conversation with an officer and someone from the healthcare team on the street, and they say, all right, time to get you some treatment, some addictions care, place to live, whatever. And there isn't a space like that available because we have more people than we do spaces. That's the big problem we're facing here. So isn't there a bottleneck issue here, and how does that get addressed in this?
So just to repeat the question, it's Craig Needles.
Craig Needles, Blackburn Media.
Blackburn. Is there a bottleneck issue? This question is for the mayor in relation to moving people from one specific area to another.
Yeah, I'll start, and I'll let the chief jump in if he has something to add, given he's deploying the actual strategy on the ground with the community partners. But this is exactly why we've been lobbying the province for additional resources on the operational side for the wider suite of community services. This is why we've said we need more mental health and addiction supports within communities of our size. It's why we partnered with the Ontario Big City Mayors and the Association of Municipalities of Ontario to make those advocacy efforts. And what we have coming is more spaces and more resources. So on the ground now, we have community partners who have said we can free up some spaces to accommodate this strategy. In about a month and a half from now, we will be opening the new Heart Hub, which will bring additional capacity into the system. Council continues to create supportive housing units across the city in great numbers so that we can flow people through hubs into the types of supports that they need. And through the hubs, their acuity level is lowered and opens up more forms of housing. And that's why, the roadmap to 3,000, we were just at an announcement of a groundbreaking with St. Vincent de Paul about a new affordable housing complex that they're building. All of these things work together. So we're growing the housing capacity within the system as much as we can. We're advocating to the province successfully in many cases for additional resources to come into the city. Again, I would always take more and we'll continue to advocate for more, particularly on the recovery and treatment side of things. But also with the suite of community partners who are already supporting London Police Service, as well as others who may come in and join the strategy in coming days. A few spots from each of those partners to be able to have someone get the care they need, flow them through to whatever services they need, is actually what's going to help make the strategy successful. And so we'll start with the resources we have. We're not going to stop advocating for the continued ones we need. With the opening of additional resources in the months to come, I think that supports a strategy like this very well, especially when one of the partners is also the operator of some of the existing resources within the community. So the long-winded answer to say, we've got some capacity now, we're continuing to see it come online, and we're going to continue to advocate to grow it within the system with the province. I don't know if the chief has anything to add.
Was that your question, sir?
I have another one, but if you have anything to add to that, then you can go ahead.
Maybe I got it.
No, you're good, you're good.
Okay. My other question was about what happens when we hit that bottleneck. Because as the mayor said, there's spaces that are coming in future tense, but they're not here yet. So if we start with this program now, and an officer runs into someone on the street, they're using drugs, open air, they say, hey, we need you to knock that off. They say, okay, can you give me some help? And then there's nowhere for that person to get help because our spaces are at max, at capacity. What do police do in that situation? Do they just let the person head back to the street? Do they then have to arrest them? How does that part of this work?
All right, so the question for the chief is, when we've hit that bottleneck, when there are no places for anybody to go, what do we do as police officers?
Thank you for that question. I'll say this. Here we go again, and this is not intentional from you, sir. This is the larger perspective, is that it's a police problem, right? What do police do when there's no resources? This is why it's so important to partner with the community, and this is why we're saying community safety is a shared responsibility. We're going to do our part, but we really need the community and community groups out there, and the mayor and city council are doing a great job looking at advancing resources and increasing funding for our city and our community. I would say we're all for upstream supports. We're here. What do we need to do to help support that? But I can tell you that I had a conversation with some individuals in the community 2 weeks ago, and one of the things they said to me is, Chief, people who are using drugs in open spaces, that's not a crime. They're not hurting anyone but themselves. Why don't your officers just let that go? Because it's not a police problem. And I'll say this, it has become a police problem. It really has. And we have to engage. The concern about bottleneck, so if we don't engage and we just leave that individual to use dangerous drugs, it's impacting the community as a whole. It's impacting that individual. But this is what we're doing. We're not going to engage because there's no resources available. There's nowhere to take this person if they need help. So we just don't engage. That is a terrible response for us. Our response now is we will engage. We will engage as many times as possible. That's why the officers engaged in this strategy are the same ones. It's very important we're using the same officers in the same locations to build rapport with people, because we all know we can say people need help, but we all know not everybody wants that help right then and there. It might be the 10th or 20th time of interaction where they're willing to accept help and referrals and service. So I don't want to dwell on the premise that there's no resources to bring them when we're not even bringing people to these spaces that are not full yet. And I get there's pressures, but with this strategy is we're going to go on the notion that we're not walking by, we're going to engage, and then we're going to ask our community partners and the community to help us. If this individual wants help now, let's problem solve, because we are not the experts in this space. The community is. So we're going to work with the community, and we're going to ask that the community do their part so that our officers can respond to the 911 calls and the public safety concerns that were needed all over the city.
Yeah, I want to add something, Craig, because I think you bring up a really important point about the resources within the healthcare field as a whole. And what we have in the City of London here is a whole bunch of agencies, including the London Police Service and the partner agencies, trying to innovate to free up those resources. When we take individuals off the street and we send them to an emergency room, it's a very expensive way to deal with a healthcare issue. So what's happening? This is one program that's happening, but it's not happening in isolation. This week, City Council and the county met to receive an update on an innovative program that the paramedics are doing by getting advanced care paramedics out into the field, not with a full ambulance, but with a different vehicle so that there's not two ambulances, one without an advanced care paramedic and one with, having to go. They're freeing up additional land ambulance resources by being innovative. That is a partnership program that has been authorized by the ministry that is unique, and it is something that we have been advocating beside them to pitch. That is also part of the solution, freeing up those sorts of resources. We have David and the work that's being done at LHSC in dealing with offload delay times, not having land ambulances and police stuck at the emergency room waiting to hand off, but the changes they've made to bring down those offload delays, to try to process people through the healthcare system faster, trying to free up resources and be more efficient. They're working on unique partnerships now, as you heard the chief say, to deploy healthcare nurses into the field in the coming months with these teams, because we know when we deploy resources into the field, like the paramedics have and like the hospital can, or when we go and put resources like House of Hope and we put people in the field, we take pressure off of those costly systems like the emergency room and land ambulance transports, and we actually try to free up capacity in the system, but also resources. So all this to say, this program does not work in isolation with addressing the overall bottlenecks within the whole healthcare system for people who have complex mental health addictions and complex health needs. So we're going to continue to work with them in partnership. This program works as a piece to a larger puzzle within healthcare capacity, and that piece includes advocacy by each and every one of these agencies, who in some cases have sat beside me at a table with the Minister of Health saying, we're all on the same team here, we're trying to be innovative, we need additional resources, and we need you to let us innovate by freeing up either legislative rules or resource capacity to do these things. We're now doing some of those things as a community. We're proving that they work, and we're proving to the province that these are places that you can invest in to take pressure off the healthcare system. So all that to say, it's part of a larger puzzle, and this is just one piece of it.
Kate?
I have 3 questions. One is very quick for the chief. Is drug confiscation part of this strategy?
So from Kate Dubinsky, CBC, is drug confiscation part of this strategy?
In instances where charges are laid, we will absolutely seize drugs. That is evidence. In instances where arrest is made, we will be seizing those drugs. But remember, there's arrest and charge, and there's arrest and release based on the discretion of the officers and the circumstances at bay. But we will be seizing the drugs. Anytime we arrest, we will be seizing those drugs.
And you don't give them back?
We will not be giving the drugs back, no.
Make it sure, okay. My second question is for Sherry Balzer, who heads Foot Patrol. I just want to know what her officers are looking forward to, like what they didn't have yesterday that they're going to be able to do tomorrow. Yeah, and what success will look like for her.
So this question is for Staff Sergeant Sherry Baltzer in relation to what her officers in Foot Patrol are looking forward to. So any changes that are being made.
I think the biggest thing that our officers are looking forward to is having the resources in our unit to properly deal with things and to having the increased complement in the unit. And ultimately, for us, the goal would be to create a better sense of safety in the community and to be able to help people towards recovery if that's what they're looking for, and try to direct them towards that pathway. Okay.
And last question is for Chris Moss from London Cares. I've spoken to a number of people who are using on the street, sort of while they're using or right after they're using, about this program, and they were really worried about the confiscation and the increased police presence and what that's going to look like for them. And I'm wondering how worried you are, or what you're thinking as, enforcement, however compassionate, increases, and then stress levels of people on the street increase, and what you're hearing from your outreach workers and the people that they work with about as this moves along.
So this question is for Chris Moss from London Cares. Kate has been speaking to people who are worried about the drug confiscation, and so she's asking what Chris Moss has dealt with in relation to this.
Thanks for the question. I think right now it's still new, and our teams are getting used to what's going to happen. I think what we do have is really solid relationships. So we have a team of 80 staff, and out of these 80 staff, they know every single person that is out on the street. And so what they're going to do is leverage those relationships. They're going to create trust, and they're going to care for folks. And I think that it just through that trust, they'll be able to help steer them towards the partners that can care for them when they need that.
Yeah, I'll jump in and say something. The other thing that I think is part of the strategy is the different approach we're taking. So yes, the police will be there, but they're going to be present with outreach workers, nurse practitioners, those who have expertise here. And what Chris just said about the trust factor, part of the strategy of bolstering the Foot Patrol unit is that it's going to be the same individuals, if I'm correct, going out on a regular basis who get to know them. We see this with our CIR teams as well. When we send the same teams out, they get to know the population, they get to know individuals, and hopefully can steer them to the resources they need rather than to interactions that lead to perhaps fear of enforcement or confiscation or all those things. Like the pathway here, the ultimate pathway of this out of the community that I think all of us are supportive of is people actually getting the care they need, breaking the addiction that they may have, and getting into a pathway that ultimately makes their lives better and takes some pressure off of the community for those, and again, not everyone, but those who are most disruptive to the community and consuming a lot of resources. So, yes, the chief talked about the enforcement components of it, and it can be easy to get hung up on that. But if you look at the actual way the strategy is being deployed by integrating those who have compassionate approaches, those who know the individuals out there, and then the setup of bringing others in who can be consistent faces out there and engaging, that sort of repeat engagement also we know can lead to people making the decision to change their lives and maybe seek treatment and recovery services when we start to build those relationships with individuals. But I think the chief's been clear, though. There will be time where enforcement is necessary. And so, that may create some stress and anxiety in the community. But for those who are getting to the point where they are actually committing crimes and at the discretion of the officers, they have those tools and support from the organization available. That is one of the consequences that is out there. But as the chief said, it is not the first approach to this. I think that, again, this is a larger strategy that pulls together community partners. The strength of it is, as well, as the chief said, the constant analysis of what's working, the ability to maybe shift those resources and approaches to deal with, feedback and stress. And that may also be feedback from the other members of the community. Like, we have a wide range of perspectives on this. Those who are suffering in the streets, those who are impacted by that, the frontline officers who are going out there and actually deploying this work, and I want to say, I know this wasn't part of your question, to the Foot Patrol team and the agencies who will be out there on the front lines, they have the most difficult job in this. like deploying that compassion, balancing the enforcement pieces, making those calls on the street, like they got a very tough job. And I just want to say, I know board members are here, I know members of city council are here, like thank you for taking this on. Thank you for the work you do each and every day, because it is an exceptionally difficult job. And ultimately what they're trying to do is provide compassionate care and a level of safety for the community. And that balance is very, very challenging to achieve. But I think we've got a great program here, and we've got the right individuals, and we've got the right people and the right teams, and we have the right leadership to make this a success. But we have the ability to adjust as we go as well, through constant analysis and review.
All right, we have time for 2 more questions. Kate, do you have another?
Yeah, sorry. Dale's saying no, but I do, so too bad. For Lindsay Ryan, I want to know where the evidence is coming from, like what the evidence, like if we're basing this on some other place that's done this, and then afterwards for the chief, or maybe for Lindsay, like what success looks like. Is it the fact that in 3 months I will not be tripping over people huddled outside the library smoking a pipe? Or is it that those people are in treatment? Like, what does success actually look like?
All right, so for Sergeant Lindsay Ryan, where is the evidence coming from, and what does success look like?
Thank you. So we took a lot of our evidence from the Peterborough Police Service, who started their strategy a couple of years ago. And they also use sort of a tiered approach, which is what we're going to use. So that first starts with the engagement with the individual, and then works towards enforcement if absolutely necessary. Sorry, what was the other part of the question?
No, that's kind of it, like what
Okay.
the evidence is and where.
Okay.
Can I follow up then? Because I think Peterborough canceled theirs because it wasn't.
Okay, I can't speak to that, but can I also add one more thing? Sorry. So it was based on the Peterborough Police Service, but also on, we brought in something that's well-founded in research called deterrence theory. And that's just sort of using sort of a carrots and sticks approach to dealing with things. So the idea is to have sort of as many carrots as we can, and that comes in the form of community resources. So the goal is to engage with these individuals, offer them these carrots in hopes of sort of encouraging them to change their behavior over time, and something we want to see. And then sort of the last option would be to use a stick, which would be an enforcement in this sense, but yeah.
So I'll also add to that, when we review a strategy, there's a lot of work that goes into it. Lindsay's team has worked tremendously on this strategy. And I can tell you from the lens, when it came up to the executive office, not only did I review the strategy, I looked at what was happening in Edmonton with Chief Dale McPhee and the learnings from that strategy. I also have knowledge from initiatives that have been occurring in New York City and New Jersey that have proven very successful. And everything that we're doing here aligns with what we want to achieve. And I'll talk to you about some key performance metrics, what success looks like. Well, success looks like our business community feeling safe, less occurrences and instances of open drug use, less vandalism, less property damage. Success also looks like 20 years ago when I used to be in this city and walk downtown, Midtown, Old East Village. That looks like success for me. There's a vision here of this city that the mayor has and his councillors have set for this city. And there's a lot of big things that are happening in this city. Everyone's doing a lot of work. There's a lot for us to get to, but I see it. I see from a community safety perspective, my job is community safety. What do I need to do, trusting that the leaders and the organizations in this city are doing their part to advocate for themselves, but to really work together. Success looks like a safe community and a safe city.
All right, if there are no more questions, This concludes our press conference. Again, thank you all for joining us today. We'll post the media release on our website and social media after the completion of the press conference. Thank you.
Can I ask question?
Sorry,
Can
you,
I ask question?
are we still?
It's up to you. I'm not from media, but if something wrong happening on one place within couple months, or yesterday something happened twice, so what is the plan of the police, please?
Okay.
My English is really bad, so if my words hurt you, I'm so sorry. But the problem is, one time they break the door and they stolen the stuff, and yesterday they fired 2 times on my place. And before, in 2021, they break my back doors in daytime, around 10, 11 o'clock. And couple months ago, they burned my backyard, so I don't see any positive response from the police, sorry to say.
Okay, so I'll repeat it. What happens if something happens continuously at the same location?
Yes.
So you're sharing a concern that we have heard and we have listened to. This is why tomorrow we're launching this strategy as early as tomorrow. So we hope, it is our intention, that instances of repeat violations that are occurring to you, your business, your home, sir, stop. And specifically, because we're live, I would certainly love to sit down with you to hear about your concerns. We have Staff Sergeant Sherry Baltzer that will pay particularly close attention to your specific concerns and your needs, and will share with you how we'll address them.
Okay, thank you everybody for coming.